Hi class, this is Dr. Heather Austin Robillard, and this lecture video is going to be over purging disorder. Formally described as eating disorders not otherwise specified, or EDNOS, in the DSM-4, DSM-5 now considers a group of diagnoses in the category Other Specified Feeding and Eating Disorders, or OSFED. This category has 5 subtypes: atypical anorexia nervosa, which is anorexic features without a low weight; bulimia nervosa with a low frequency or limited duration; binge eating disorder with low frequency and limited duration; purging disorder; and night eating syndrome. This lecture video is going to be on purging disorder. To be diagnosed with otherwise specified feeding and eating disorders, or OSFED, a person must present with feeding or eating behaviors that cause clinically significant distress and impairment in areas of their functioning. But they do not meet the full criteria for any of the feeding or eating disorders in their full thresholds. Purging disorder is defined as recurrent purging behaviors that influence one's weight or shape, but it is in the absence of binge eating. It does not meet criteria for anorexia nervosa because of the absence of low weight, and it does not meet the criteria for bulimia nervosa because of the absence of binge eating episodes. So let's look at how purging disorder compares to the other eating disorders. Purging disorder versus anorexia nervosa differs in its body weight, with individuals with anorexia having a significantly underweight, whereas individuals with purging disorder are not underweight. Purging disorder versus bulimia nervosa differs in a couple different ways. The first is that it differs from bulimia nervosa in the binge eating. Individuals with bulimia nervosa have a reoccurring, objectively large binge eating episodes, whereas individuals with purging disorder do not. It also differs from bulimia nervosa in the levels of concern over eating, disinhibition around food, and reports of hunger, which are all lower for persons with purging disorder compared to those with bulimia nervosa. A primary difference between purging disorder and bulimia is that people with bulimia nervosa report a greater loss of control over their food. Some research suggests that purging disorder may be less severe than bulimia nervosa. Findings also suggest that there is a difference in appetite regulation between purging disorder and bulimia nervosa, in which purging disorder may be characterized by excessive satiation, whereas bulimia nervosa is characterized by deficient satiation. Therefore, purging disorder means they get full really quickly, whereas binge eating or bulimia nervosa, they do not get full very quickly. Here is a nice chart that shows you all the differences between anorexia, bulimia, and purging disorder. Anorexia being the restriction of calories and an unhealthy body weight, bulimia being individuals who participating in binge and purging episodes, whereas purging disorder is the use of purging behaviors after just a normal meal. The weight for those who struggle with anorexia is significantly underweight. Bulimia can vary between normal or overweight, whereas most individuals with purging disorder have a normal weight. Anorexic individuals eat fewer calories and have limited food varieties or odd food rituals, whereas individuals with bulimia tend to eat large amounts of food in a short period of time that follow any kind of compensatory behaviors. For purging disorder, individuals eat a normal-sized meal or snacks, and then they report feeling full, which then leads to purging. The prevalence rates for anorexia, bulimia, and purging are as follows. Anorexia is 0.5 to 0.1%. Bulimia is 1 to 2% of women, and purging disorder can range from 1.1% to 5.3%. There are subtypes for anorexia nervosa and bulimia nervosa, including restrictive type and binge eating and purging type for anorexia, purging and non-purging type for bulimia, whereas purging disorder is its own subtype from the otherwise specified feeding and eating disorders. For who gets purging disorder, a proportion of those seeking treatment for an eating disorder, it indicates that purging disorder is a presenting problem for 5 to 10% of those adults and 24 to 28% of adolescents who are seeking out treatment for eating disorders. This diagnosis might become more common if excessive exercise gets classified as part of a purging disorder. Patients with purging disorder often report feelings of gastrointestinal distress after eating, more than those who are healthy or even those who have bulimia nervosa. Some patients with purging disorder may feel that their vomiting is even automatic. According to Keel and colleagues in the Clinical Handbook of Complex and Atypical Eating Disorders, patients with purging disorder often resemble patients of anorexia nervosa in their temperament and their interpersonal interactions, more than they resemble bulimia nervosa personality characteristics. People with the following may be more likely to develop a purging disorder. They have a higher BMI, they fear weight gain, they have a focus on being thin, an unhappiness or frustration with their body, a history of dieting or attempting to lose weight, feelings of losing control over their eating even if they don't eat very much. They have less care from their mother while growing up. Some studies show that people with purging disorder may react differently to food. For instance, their stomachs may cause certain hormones after eating. These hormones may cause them to feel full even when they haven't eaten very much. As with most eating disorders, there are co-occurring disorders that come along with them. In purging disorder, there are elevated rates of mood, anxiety, and substance use disorders compared to individuals without eating disorders. Anxiety appears to co-occur with purging disorder most often, with 39 to 43% of women with purging disorder also struggling with an anxiety disorder. Rates of mood disorders appear to be lower in purging disorders when compared to bulimia nervosa. Women with purging disorder report slightly higher rates of substance use disorder compared to those women with bulimia nervosa. However, it's not statistically significantly higher than those with bulimia nervosa. Purging disorder is also associated with an elevated risk of suicide and intentional self-harm. This is the end of the lecture for purging disorder. You have learned about the different diagnostic criteria for this subtype of otherwise specified feeding and eating disorders. You've compared it to bulimia and anorexia nervosa, and you've learned some of the risk factors of those who might develop a purging disorder. I hope you've enjoyed this lecture.